Hello, 大家好, and welcome to this very special Voices edition of the podcast When Does It End? AANHPI edition. In this episode of When Does It End, we discuss serving the HIV needs of Asian American, Native Hawaiian, and Pacific Islander populations across the United States. From topics of sex to representation in data and services to cultural barriers, we talk about it all. So sit back and relax. But listen closely because you won't want to miss a moment of all the knowledge that will be dropped. We hope you hear our voices the way this conference captures, validates, and uplifts all AANHPI voices. Hi, everyone. Thank you so much, Chris and Tori, for having me. I'm really honored and thrilled to be here with community leaders such as yourselves. To everyone out there, my name is Emerson. My pronouns are he, him, his, and I currently live in San Francisco, which sits on Ramaytush Ohlone lands. I am a first-generation Chinese American, and I am a gay man. I inhabit both identities fully, as well as many other identities, including being queer, working in public health, and being a yoga instructor. I received my master's in public health from San Francisco State University in May of 2020, where I really focused on identity formation of Asian American and Pacific Islander men within the constructs of Western narratives and how those really lead to negative health behaviors and negative health outcomes, particularly when it comes to sex and sexuality. So while pursuing a topic like this may seem a little narcissistic because it's about me, it really comes from a place of not seeing myself and broader Asian Americans, Native Hawaiians, and Pacific Islander populations reflected in data. It also comes from a place of really not having these kind of conversations, even within our own communities, about the underlying fetishizations that are barriers to our community from accessing sexual health services. And really, I'm here to say that we're here and we matter and that our experiences are valid.
Often when it comes to talking about marginalization, the conversation always to be themed black and white or gay and straight. Thank you for showing us that you can share different and multiple identities outside of what we traditionally view. I'm excited for the rest of this conversation and I'm eager to learn some more from you.
Yeah, thank you so much for that affirmation, Chris. The beauty of intersectionality is that we can be many different things and we are many different things. However, because our identities are so intertwined, it's hard to find the beauty in all of yourself when one or more of your identities is marginalized and devalued. And as a gay Asian American man, I've had my fair share of hurt and self-hate from having two sets of paradoxes set upon me. And the first is the inability to truly assimilate due to the model minority myth. And the second is the fetishization and desexualization of the Asian man. And that is to say, Asian American men are constructed as desexualized, submissive, more feminine, and especially in gay communities, a bottom. This makes it impossible for Asian Americans and Pacific Islander men to achieve perfect male status. And both sets of paradoxes are a result of multiple systems of oppression that we can simply call whiteness. From Orientalism to the phrase no fats, no femmes, no Asians, to being prescribed a submissive bottom. Whiteness is a form of power that is built on sexual and gendered racism.
Emerson, in what ways have these past collective traumas you just mentioned affected Asian communities today as it relates to sex, safety, and pleasure?
Yeah, we absolutely see the effects of this now, Chris. In an attempt to reconcile and cope with stereotypes and that intergenerational trauma you mentioned, many gay Asian men have turned to really alarming trends. And these include internalizing toxic masculinity, race-based perceptions of the undesirability of other Asian men, and risky sexual practices due to large power discrepancies with white men. And these trends share the thread of how oppressive power structures influence one's identity formation, consciously or unconsciously. The resulting behaviors lead to a higher risk of HIV and STIs. Let me read you a quote from an ethnography by C. Winter Han called Geisha of a Different Kind. The quote describes an Asian man's experience with a white man. I know about safe sex. I've seen the ads, read the books, went to meetings. But he said he wouldn't do it unless it was bareback. He told me he wasn't really into Asians anyway, so it would be no big loss for him. But I thought that if I did what he wanted me to do, he would see me again. Who knows? I mean, how often does a guy like that actually want to have sex with someone like me?
Thank you for bringing that into the conversation. And again, as a Black trans woman, I get it. One of the reasons that Black trans women and men, and also non-binary individuals, that we're at increased risk of HIV is often due to unequal power dynamics in our sexual relationships. And I'm not talking about the top versus bottom thing, but what I'm referring to is the fact that so many of us are having sex with people who simply don't see us as whole. They also see us as powerless, you know, and when power and control are out of balance, it's really often a sign of an unhealthy relationship. And unhealthy relationships, as you just said, Emerson, using different words, they often lead to unhealthy sexual practices and making unhealthy choices.
If I'm correct, I remember you saying that because of intergenerational trauma, many queer Asians have developed coping mechanisms to deal with the cultural stressors of intersectionality. Could you briefly talk about sex and how HIV risk behaviors come into play within Asian communities?
Well, Chris, from my experience and from the experience of other Asian Pacific Islander households, is that sex is just not really discussed unless it was in context of carrying the family name by having children. Intimate scenes on television or movies were always really uncomfortable to watch. I mean, I would feel so uncomfortable watching with my parents. I never had the birds and the bees talk. My sex education either came from school, the internet, but then luckily, mostly from the queer community.
So Maya Angelou states that we are more alike than we are unalike. And that is so true. Many of us have heard stories about the experiences of folks like you, Emerson. Some of us have even experienced those type of stories. Here in the US, there's actually a history of discrimination against AAPI people that only people of Asian descent can truly articulate. What I hope tonight is that our audience truly appreciates this discussion. So folks, welcome, welcome, welcome. Please tell everybody that's listening who you are, what you do, and where you're doing.
Hi everyone, my name is Bill Lee from Los Angeles, California, and I work at APLA Health as a PrEP education specialist, working with Black men and educating them on PrEP education and also building communication skills.
Hi everyone, I am Cecilia Chang. My pronouns are she and hers. I am in San Francisco, California. I work for Transgender Law Center, and I founded a network of trans people living with HIV back in 2015 called Positively Trans. And I don't do direct services. I do advocacy and policy work and focusing on reducing stigmas and cultivating leaderships amongst trans people living with HIV.
Aloha, good evening. My name is Bianca Tasaka. I hail from the islands of Hawaii. I work at Malamapono Health Services here on the island of Kauai as a medical assistant phlebotomist. We do offer the gamut of HIV, STD, and HIV services, as well as case management, PrEP services, and trans and women wellness. We also do outreach services as well as syringe exchange, and smoking cessation.
We know that Asian American and Pacific Islanders make up at least 6% of the total population in the US and its independent areas. And then Asian American and Pacific Islanders accounted for about 2% of new HIV diagnoses in 2018. How can gaining a deeper understanding of the Asian American, Native Hawaiian, and Pacific Islander communities enhance our EHE efforts and help end the HIV epidemic in the US?
Thank you, Chris, for bringing the fact that you said 4% or 2%?
Well, I said, so 6% of the total population, but 2% of new HIV diagnoses is from the Asian American, Pacific Islander, and Native Hawaiian communities.
Yes, 2%.
Mm-hmm.
So coming from my background experience, working with Asian populations, and just understanding the model minority myth and the theory that we have to do well and be good. And there is no idea of sex talk in our community, and the idea of just silencing our sexual identity in addition to just talking about sex within society is taboo. So bringing that within the Asian population and having discussions and discourse around HIV prevention within our community, I believe through education and prevention is key to stopping and ending the HIV epidemic, specifically with the Asian population.
Bianca, what are your thoughts?
Thank you for this space. As an Asian and Native Hawaiian individual, I definitely create space for my community and let them know that I am a part of this culture. And so I think having someone that is a part of that Asian culture or Native Hawaiian culture in your services or in your providing these services to the community makes a great deal for our population to come in to seek service. And I know that for a fact, as a trans individual, it's hard for me to seek service as is. But knowing that I take space in these places where health is much of a concern for all of us, and being there for that health navigation part of this process makes a big deal for our Native Hawaiian and Asian Pacific populations here. As in Hawaii, we are a melting pot. So we do have an influx of definitely Asian populations here. So I think also having verbiage and specific things for different cultures are great for them to understand. Thank you.
Cecilia, I know you have tidbits.
Because to really understand, how HIV impact Asian Americans and Pacific Islanders, we have to recognize that we are not a homogeneous communities, and we're made up of so many different communities, and we have all these different country of origins, different cultural practice, and sometimes, we have different languages as well. And on top of that, I think that it's really worth mentioning is that there is also a percentage of Asian Pacific Islanders here in the United States who are foreign students coming here to go to college, and I can tell you that happened once, before when I was doing some consulting work with Asian Pacific Islander Health Center, that they had somebody calling in and said that, we have a client who tested HIV positive, but he doesn't speak any English, he speaks Mandarin, can you be the interpreter for us? So that kind of situations already set up barriers, for folks to get linkage immediately. And not to mention that I think that Bill had also mentioned, we don't talk about sex. That's not part of our upbringing. My mom and dad, they didn't talk about sex. I didn't know where I came from growing up. And I think that, those are the things that those taboos are the things that we also have to overcome. Becoming a sex positive culture, it's going to take time. Unfortunately, of course, we know that HIV doesn't wait for you to catch up. And so, these conversations are really important. And especially we need to like encourage parents to like talk to, like their kids more, like about how to protect themselves. This is not a moral issue. This is really about health issues and and to really take good care of themselves. It's no different from like COVID-19 that you need to get vaccinated and wear a mask. So let's take the stigma off like HIV. Let's take sex off, stigma of sex, like so that we can have frank conversations, like with our own community.
Emerson, would you like to lead us to our next point of conversation and focus?
Yeah, I would. I would also like to say that thank you so much for bringing all those points up. I think people often forget that AANHPI is not a racial category. It's more of a coalition building category. We are all part of this and we stand in solidarity with one another. But that doesn't mean we don't inhabit all our identities. We do, in fact, inhabit many different identities, many different ethnicities, and those are so specific to us. And I would love to hear, let's start with Bianca, then Cecilia, then Bill. I would love to hear how our different subgroups of the AANHPI community that you work with experience HIV differently.
Thank you. That's a great question. And we've been having an influx of the Micronesian population here on island. And so what we've been having to try to navigate is interpreters, so they can understand the verbiage and the information that is needing to be passed on about susceptibility, about engagement, in ways to protect themselves and create a fluid health perspective in their life, as if they're gonna go and get checked up. It's like something that they can fluidly have in their lifestyle, where if you're gonna go check up on yourself, you can do that too. It's a part of our health that we need to realize that no matter what culture we come from, there are languages that interpret these things for other cultures that better help understand them. So I think that's the number one thing, especially in Hawaii, because it's like a melting pot here. We have Asians, we have Polynesians, and when I mean Polynesians, I mean Tongans, Samoans, Tahitians, and there are words and verbiage that better describe these situations and things when people want to access, such as HIV education or testing and services, for them to better understand. Thank you.
Thank you, Bianca. Cecilia, I'd love to hear from you and your perspective working at the Transgender Law Center.
Okay, so I think that before I talked about Transgender Law Center, I think that it's really important, and Chris, you said it so much better than I do about representations. And I think that that's one of the building blocks, like in any community buildings and mobilizations, is we need to see ourselves in order to feel safe, to discuss about like what we are like encountering and our experience. So I'm not going to talk to my mom about like not knowing how to put a condoms on the men. I need to talk to somebody that's my peer, like around my age, that looks like me and talks like me, and so building those community, I think, is the number one priorities. Like before we can even talk about HIV prevention messagings and and doing intervention. So that's a different challenge that we see. And that's what we are also advocating for, is to end data invisibilities. And because erasure is one kind of discrimination, because when we get erased, we don't get resources, and people kept thinking that we don't exist, so here I am, talking to you, but, on paper, I don't exist. So that's a big problem. And also, in addition to that, I think that this is where we need to build more solidarity across communities of colors, especially Black and Brown communities, because disproportionately impacted most by HIV are Black communities. So, and we need to really reach out, to our Black and Brown siblings, to make sure that we come up with strategies, to deal with this together, so until we can actually build a more powerful base, we have a lot of work that needs to be done. Otherwise, we won't be ending the epidemics amongst our community. It might end the epidemic for the white community, I'm afraid to say, but for us, we need resources, and we need a lot of more resources, in order to achieve that.
Definitely beautifully said. The idea that representation is key, and understanding the model minority that we're good, right? We're all good. We don't need anything. We got all the resources. We don't need any help, right? So it's that idea that we do need resources. There are Asians that are poor, and there's Asians who are in poverty that aren't talked about. Those aren't the model minorities that everyone hears or has an image of. So it's definitely shifting it back to having an intercultural prevention strategy that will help all cultures and not leave the 2% behind.
I actually want to ask a question, and I want to direct this specifically to Bianca and to Bill, in part because of your roles. And you two both work in direct services. In a CDC study conducted in 2010, more than 40% of gay and bisexual NHPI men had never been tested or had not been tested in the year prior to the study. And one of the most common reasons that they cited was because they simply didn't think they were at risk, in addition to all of the things that you pointed out, Chris. So what I'd like to hear first from Bill is, why is it that these guys are having this issue? What is risk? And is it different for a person of AANHPI descent? And then Bianca, let's also talk about the trans community, who are also Asian American, who are also Native Hawaiian, who are also Pacific Islander. And we also know that there are a number of different terms that folks use other than transgender as well. So let's hear a little bit about that. Why do folks feel they are at risk? Aren't you all having sex?
I think, I may not be right, I may not be wrong, but it's the lack of information, the misinformation, the non-information, the non-conversations that are having. And so, with a lot of misinformation, a lot of not tailored information towards the Asian population, I think a lot of miscommunication happens. And with that, one can have miscommunication or misinformation that may empower them to have unprotected sex, or to not even care about their status. And so I think it's, Tori says, Bill, give us some misinformation or one lie you've heard. One lie I've heard is that you can't get HIV, or that I'm protected, or that it's a one-time thing. It's fine. And so these are narratives and dialogues that people have and beliefs. And so it's that idea that with education and information, we can debunk these beliefs that they have and provide actual knowledge and truth based on information and science.
I'm going to be really honest. I believe, as an Asian Pacific Islander and Native Hawaiian, I think the fact is that we still don't think that oral sex is a risk. Even if we are still engaging oral sex, I believe that sometimes some individuals feel that that's not much of a risk than rectal sex or penetration. And I do believe that as a mahuvahine in Hawaii, fa'afafine, akavaine, in different cultures, what's great is that we have a sisterhood. And with that sisterhood, we definitely let each other know about certain situations that may arise for us. May it even be safe sex talk, relationship talk, because we don't have that people to talk to about those certain things. And I think when you have someone to talk to about these type of situations that might come up for them, I think it needs to be the right individual that understands and also can help them navigate through this. Because I think that's another part of this, is not having that person to navigate them through this time. And I think that's vital when someone tries to seek out any type of service. May it be HIV education, may it be a common cold, or by fact, due to COVID, we're not at risk. I'm not having sex.
So you brought up something really interesting, and I'd love for Cecilia to tack on, thank you, Bianca, about the role of peers. All right. There is nothing like talking to somebody who gets it. And if I believe, all of us, I think, and each of us are saying it in different ways, the role of people who have lived experience in eradicating HIV and ending the HIV epidemic. You're onto something there, Bianca, and I appreciate that. So Cecilia, you talked about what you do, and you talked about Positively Trans and the work that you do at the Transgender Law Center. But I think folks really need to hear how important peers are, even when it comes to TASP, which you can also tell folks what that is as well. Because ending the HIV epidemic doesn't just mean that people who don't have HIV don't get it. It also means taking care of people who already have an HIV diagnosis.
Yeah, thank you for bringing that up. I think that, a lot of times, we really need to unpack what stigma means, in our communities, and it actually impact, our decision makings, in terms of accessing services. Like for transgender women, because we get lumped with men who have sex with men so often that we tend to resist going to a HIV clinic that actually was in the middle of a gay neighborhood, or or is known to be a service provider catering MSM, and so because of this kind of set up, we feel discouraged. So, even if we go get tested, we are not going to follow through with linkages, because of the perceived risk. It's not necessarily real risk. So building a trusting relationship takes time. And it also, we need to see investment in our community. And I think the other things is we need to make sure that we really use the harm reduction approach to the entire HIV spectrum. It's not about taking medications every day either. It's about if you can reduce the risk that you have for yourself and reduce the risk you have in a sexual relationship, why not? So especially we now have the science to back that up. PrEP is something that is readily available that anyone could get from the providers, and so there's no reason why we still have such high numbers of HIV infection that's happening today. And the other things that I think that we need to also educate our community is that HIV is not a death sentence anymore. So often that it's easy for us, and for us, I mean, I used to feel like I had to hide somewhere, feeling pity for myself because I got tested HIV positive before medication came out, but since medication came out, and it's totally manageable. So, but these are stories that we need our peers to tell us, that they would be the best witnesses to the advances and give testimonies that, we can follow on. And I also want to mention that, the other things that is really important is, we know that there is a high percentage of Asian and Pacific Islanders gay men who use crystal meth. Like there was a large scale MSM study that had done, and they all reported that they have used crystal meth, like prior to like having sex. But that's not something that we talk on a daily basis. Like we don't sit together and say that let's come up with some strategies to protect ourselves when that happens. Like what can we do to help ourselves, remind ourselves that we need to protect ourselves. So maybe PrEP is the answer, maybe not, but we need to like find ways to normalize these conversations.
Emerson is going to close this out.
Thank you, Tori and Chris, for having me co-host with you. It's been so fun. I hope we get to do it again. Thank you to our panel. Thank you, Bill Lee. Thank you, Bianca Tasaka. And thank you, Cecilia Chung. You matter, your work matters, and your knowledge has given us insight that will hopefully be translated into the work that we do for the communities and the communities we stand in solidarity with. I'll close out the way I close out my yoga classes then. May those who are lonely come out of their loneliness. May those who are suffering come out of their suffering. May what I do be of benefit to others, and together may we be free. Namaste.